Hello, it's Tony here once again, and this time I am doing an exercise video and placing it on the Laughing Griffin Crafting channel, as I'm kind of pretty much done with trying to do 3 channels at once. So I'm simplifying things and just going to put exercises on the main channel. I'm thinking of changing the channel name as well. Anyways, as the title of this video is about knees, this is exercises to do for someone with knee pain or mild to moderate levels of knee pathology. I'm going to preface this by saying that this was specifically done on request from someone whom I know and I have evaluated already, so I know these exercises are good for that particular person. So this is not necessarily the best exercise routine for everybody or necessarily for any like post-surgical things. So be sure to check with your therapist or doctor. So the first exercise is, of course, just what I'm doing here, stationary bike exercise. The idea is we want an alternative cardiovascular exercise as well as repetitive movement of the knee to loosen it up for any type of arthritis. Next exercise I'm going to be doing is walking in reverse. Now I am demonstrating this with the use of a treadmill, and I put a pad in place so that I could walk backwards, and I don't have the treadmill on, the treadmill is off, so I'm actually providing some resistance going in reverse. Here I am actually strengthening my quads a bit, and plus there's all sorts of benefits for walking in reverse that I'm not necessarily going to go into on this video. But needless to say, if you can't do this on a treadmill, just walking in reverse in a location that is safe enough to walk backwards is perfectly fine. Also, if you have someone else that you can do this with, you stand back to back, and as the person is walking forward and walking slow, you could be walking into them in reverse, providing resistance to you as well. I didn't have another person in place to demonstrate this, but I think that description is good enough. If you're doing, I'm showing walking backwards, but of course walking forwards is also pretty beneficial for many knee conditions as well. So just because I'm walking backwards does not necessitate that you should not also walk going forwards as well. Okay, next is a very simple seated knee extension. It's exactly as you see it. I'm sitting down, extending my knee. Now, I am going to just give a little preface to this. 3 sets of 10 repetitions. We like to use this a lot in the therapy world, and I'm going to, again, preface this here. But that doesn't mean that you have to do it exactly 3 sets of 10 repetitions. You can certainly do less repetitions with more weight, as I'm going to show here with a ankle weight. And if you don't have ankle weights, it's not the end of the world. You're still going to get some benefit from this. And again, you're not really supposed to be using heavy weights for this type of exercise anyways. When you have knee pathology, just the light weight is perfectly fine. Now I say the 3 sets of 10 because it's just a good goal to have. You're still going to get benefits even if you don't do that many. Here I'm demonstrating another way if you do not have leg weights, which is a very slow and controlled method. Now you see how slowly I'm going up and down. This is also a good way to provide some strength to the area without having to put a lot of emphasis on having excessive weights available. And here I'm also demonstrating that you don't need those leg weights if you have bands. I have done numerous band videos as well. Again, the same exercise, just adding the bands on can provide a little bit of resistance. Again, not super heavy resistance. Next, I'm demonstrating here a seated hamstring stretch. This stretches the back of the thigh and the back of the knee. So I'm going to be sitting up straight. I bend forward at my hips, not bending my back to come forward to stretch out the hamstring. And I will want you to do it for at least 1 minute on each side. Now, obviously, I'm just doing this for demonstration purposes, so that it's for time constraints. Here, I'm doing a knee flexion stretch. It's just as you see. I'm just trying to bend my knee back in a seated position. Again, doing both, doing them for 1 minute on each side. Of course, you'll be doing it for a full 1 minute, and that's a 1 minute on a clock, not just counting in your head. And now I'm moving on to a supine hamstring stretch. So you can do this, of course, on a bench like I am. You can also do it on the ground. I would prefer that you do it with either a yoga mat or something padded underneath for comfort. This can easily be done on a bed. If you're someone that has a lot of problems and disability and you can't get onto the ground and get off of the ground, please do it on the bed. Don't try to do it on the ground. It's just not worth the hassle of trying to get up if you're someone that can't. Here I'm demonstrating another tool. This is a little stretch item that I have to assist. You don't have to have the specific item. A regular towel or a belt will do the same thing. Next, I have a standing knee flexion, active range of motion. Here I am keeping my knees aligned with each other, not like this, where you're bringing your heel up towards your butt. And if you're doing this exercise properly, you're really going to feel it in that back of the thigh, in the hamstring. You can, of course, add on a ankle weight or do the super slow sets variations that I've already demonstrated earlier in the video for more resistance and more of a challenge. The next one is going to be a standing knee extension, but it's going to be specifically with a band behind my knee. So what I'm doing is right here, I'm really contracting my quadricep muscle quite well to straighten out the knee. So that top muscle right there is what I'm contracting. The other leg is staying completely still. And this really helps to preserve the strength at that end range of motion of the knee. Again, a big part of this whole program that I'm demonstrating is not necessarily just to get rid of pain, because that might not actually occur, but it's to at least keep you strong so that you can be able to do functional activities such as walking and standing. Next one I'm demonstrating is a standing knee extension open chain exercise. And as you can see, I'm just standing up and doing what is similar to a snap kick in karate, but without any of the velocity. And this is to demonstrate another one, which is going to be the same motion, except with the use of bands. So I'm getting my band set up. Now, of course, if you don't have an ankle strap like this, you can still do this exercise, but it makes it a little bit more difficult. So if you have that ankle strap, please feel free to use it. And again, as you can see, I'm just trying to strengthen up that muscle. If you have balance issues, obviously you'll need proper support on the other side. And here I'm doing a version of that standing hip flexion exercise that I showed you before, just demonstrating that you can use bands for it as well. Quick edit to demonstrate it from the side of the camera so you can see it a little bit better. Again, it's just a hamstring pull, nothing too extraordinary. Okay, the next one I'm demonstrating is going to be a quad set. Basically, I'm going to be having my knee and contracting my quadricep muscle as if I'm pushing down into the ground in the direction that you saw. Once again, you can be doing this on a bed. You don't have to be on the ground for this if getting onto the ground is contraindicated for you. So it's just doesn't look like I'm doing anything, but I'm really squeezing that quadricep muscle and then I'm letting go. So I hold for 3 seconds, let go for 3 seconds. Hold for 3 seconds, let go for 3 seconds. Moving on to heel slides. This is where I'm bending the knee by sliding the heel up towards the butt. So I want to take a moment here to explain. This is not just an exercise, but also a technique. This is something that you should do first thing in the morning if you have a lot of arthritis and stiffness. You do this first thing and you do a good 100 repetitions of them. Moving on to the straight leg raise, I'm basically doing that quad set and then lifting the legs straight up. So my leg stays straight. You saw me demonstrating that I'm keeping my abs tight with this. So I'm engaging my core when doing those straight leg raises. Okay, moving on to lateral weight shifting. This might not be the best exercise for every single person that has knee pathology, but this is a more advanced move. This is certainly not as hard as squatting or lunging, but it gives you some of the benefits of those type of exercises. So I'm just basically, my feet are staying pretty much planted for the most part, and I'm shifting body weight side to side. And then there's also the forward, anterior to posterior weight shifting, where I'm shifting my body weight front to back. And again, there's a slight bend in the knee, and then a slight knee bend in the rear knee, going back and forth. Again, this is to create as much stability as we can in the knee as possible, preserving strength. It can be rather advanced. Again, you have to be the right type of pathology for these kind of maneuvers. This is not for everyone. And again, doing it on both sides is important so that you don't end up with imbalances. Next, I'm demonstrating the quarter squat. So this is an exercise, again, not necessarily for everybody, where you're bending at the knees and coming back up straight. This is as if you're about to sit down in a chair. You don't go down all the way, you think better of it, and you come back again. So keep in mind, you don't want your knees going really deep into this. You're not supposed to. So to get that other end range, beyond that, I like to do sit to stands. So as you can see here, I'm just fully standing and sitting. The bench I'm using is kind of high up. You should try to do it off of higher benches first before going to the really low seats. This will help to get you ready for eventual squats and lunges. But again, those are exercises that you may wish to not be performing yet. So just the standing and sitting works a lot of the same muscles. And what's nice about this is if your knee does start to act up and have any kind of pain, you just right back down into a sitting position where you can rest. Now I'm demonstrating it without the use of hands, but if you need to use one hand or you need to use both hands to perform a sit to stand, feel free to do so. Next is going to be the step up. You don't have to have a teal aerobic step for this. Any kind of step, a stair will do. Obviously, if you have a lower step or lower platform to start off with, that can be of benefit before you go to anything really high. And it's just stepping up and stepping down. You can use both. Make sure you switch to both sides. I only demonstrated one here. Next is going to be a calf raise. I'm going to use the wall for a little bit of support here. So my knees are going to stay straight throughout, and I'm going up and down, working my calves. Now, it's important to note here why this is not having to do with the knee. What are you doing this for? Well, the calf muscles actually do go past the knee, so it is important to work them out. Plus, it's a good structure in terms of a contributor to the gait pattern. So, yes, work out the calves. A more advanced version I'm going to demonstrate here is just going on one leg and doing a single leg calf raise. Again, that's in order to advance yourself. This is hard to do if you have knee pathology of any type. You really do have to contract and hold your knee really tight while you're doing this. So there is some benefit to the quadricep as well. Okay, another closed chain exercise, lateral step-ups. So instead of going anterior to posterior, we're going medial to lateral. This does put some different stresses on the knee, but I do feel like it's important to do that because it's a real world activity. This is something that might actually be something that you have to encounter if you're going to be anyone out walking around in public, curbs, steps of any sorts. Not necessarily going to crab walk up steps, but the option for stepping over things and your body needing to be able to perform this type of lateral action is important. Let's move on to some hip musculature strengthening exercises. Here I'm doing standing hip abduction, standing hip extension, flexion rather, with knee extension. Here's hip extension. Again, we want to be able to strengthen all of the different hip musculature. Okay, moving on to some motions that are not necessarily great to be doing at first is the squat. So the squat does put a lot of internal pressure on the knee. So for many people that have knee pathology, not necessarily the best thing to start off with doing. It's something that you can be doing later on in the program. The same thing for the lunge that I'm demonstrating here. Again, full body weight going on that joint, not necessarily the best thing to do. Definitely this kind of maneuver and this kind of maneuver, not the best thing to be doing. So avoid any type of these type of aerobic type activities where you're, in particular, this kind of stuff, any of those jazzercise type aerobic activities, I'm not going to ask that you do those. Same thing for running, jogging. These kinds of things put a lot of stress on the knee, not necessarily if you're having some mild pathology to be getting that and doing that. All right, another thing I would prefer folks doing is not necessarily doing exercises with heavy weights. Obviously, that was not a heavy weight. It's just the concept I'm trying to get across here is don't put excess weight on your knee joint. So if you're going to do any kind of resistive training with your arms, do it in a seated position, so that way you're not putting more strain on your knee. Obviously, I want to keep your upper body strong and doing upper body exercises, but if you can get away without putting excessive weight on the rest of the body and just do exercises seated, please do that instead. Okay, let's go over some important concepts for this or really any exercise program. If you're feeling pain with any of the exercises, stop and discontinue the exercise, and of course, talk to your therapist or doctor, depending on who is prescribing the exercises. More than likely, it'll be a physical therapist or a physical therapist assistant. So always stop doing it if it causes pain. It's not supposed to cause pain. Next, I give a kind of a 3 sets of 10 repetition program. It doesn't matter. You don't have to do that many. That is a goal for you to do. If you can't do any particular exercise, just try to get as many close to that range as you can. Don't feel that you have to complete exact particular numbers when you're having pathology. If something hurts and you can't do it, stopping is perfectly normal. I also want to emphasize that I did show squats and lunges, and I said don't do these. Well, that isn't necessarily true for everybody. When you get better at all the other exercises and your knee is quite stable, then yes, doing squats and lunges are a possible exercise, but you should be able to do some of these other lower level closed chain exercises, such as the weight shifting and going up the little step and the sit to stands from the chair. Those should be really good before you should start really doing those squats and lunges. I also give a lot of exercises in this particular video because I want to have variety. If you don't have variety, you get bored, you stop doing the exercise program, and then it doesn't serve any real purpose if you stop doing it. So that's why the variety. Don't think that you have to do every single exercise every single session. I give a lot so that you can do it on your own. You have knowledge of what the exercises are, and you can trade off when you need to. For questions, contact me directly if you're the person that this video is specifically made for, or leave it in the comments section. I'll try to get back to you when I can. Thanks.